Hi, my name is Tim Radersdorf, and I am the CEO and founder of Quality Health Communications. Unfortunately, organizational policy doesn't allow me to video our pilot in use, but I'm going to show you a couple pictures of what our project looks like, and then also show you a little bit of a sneak peek behind the layer of where we come up with these amazing ideas that impact the health and well-being of the world. So how does Quality Health Communications work? Quality Health Communications interfaces with the electronic health record to communicate real-time quality and safety data to the entire healthcare team. Instead of having to dig into multiple spreadsheets in the electronic health record, clinicians can make a visual scan of their work environment to determine which patient most urgently needs their attention. Through communicating this data in a HIPAA-compliant method, we are allowing nurses, physicians, and other bedside clinicians to provide team-based care and advance the performance of the unit. Through interfacing with the electronic health record, we are able to communicate to the healthcare team which tasks most urgently need to be completed. This image showcases our pilot in action. In this edition, we are using a projector mounted outside of the patient's room to display an image on the patient's door. This patient has 5 outstanding issues that need to be addressed. You can see that an admission order was placed 3 hours and 23 minutes ago. An EKG order was placed 1 hour and 5 minutes ago. The 3 badges on the right indicate how this technology can be utilized to improve communication with our patients. The background of those badges were originally the color white, but as those labs and images were resulted, they changed in color to this yellowish green. This change in color is able to be seen by the patient behind the door and allows for them to utilize their call light or reach out to a clinician to receive an update on their care. Our technology can also be displayed on tablets and television screens immediately adjacent to the patient's door and inside the patient's room. The charge nurse will also have a tablet or access to a smartphone app that will be able to provide the real-time needs of every patient on the unit in one location. The next edition of our platform will allow for bi-directional communication between clinicians and the electronic health record. This means that clinicians will be able to use our platform as the interface with the electronic healthcare record and be able to chart the tasks and jobs that have been completed immediately without needing to log into the EHR. By eliminating the need to log back in the EHR, we're giving clinicians more time to spend with their patients and do the things that they believe are most valuable to improving patient outcomes. So we are incredibly fortunate to have the backing of the Ohio State University Western Medical Center, this beautiful innovation studio, and our new partnership with Ambassador Software Works to help us as we scale our business. But what we really need is the exposure, mentorship, and network that Johnson & Johnson can provide for us. So we are so very grateful for you taking the time to review our application, and we hopefully look forward to a future collaboration very soon.